Okay, in this last section, we're going to talk about disorders of motor neurons. So, lots of different things can affect motor neurons. Trauma, infection, such as in poliomyelitis, degenerative or vascular disorders, or tumors, all of those can damage motor neurons. So traumatic injury, we're going to talk about traumatic injuries to motor neurons in chapter 17, which is the peripheral nervous system, and that's going to be in a couple weeks. That will not be on the second exam, just so you know that. The part we just talked about will be on the second exam. So, let me get to the right. Wow, I went way back to the end of the PowerPoint. So, all those different things can damage motor neurons. In some people who survive polio, they get what we call post-polio syndrome. So it's not the acute part of the illness, it comes on years and years later. And the symptoms of post-polio syndrome are muscle weakness, joint and muscle pain, fatigue, and potentially breathing problems. There may be a normal age-related strength decline, and it's more obvious in people who previously had polio. So the people that I have worked with post-polio syndrome are generally older people. A lot of them, they've sort of gone through their life. A lot of them, they have this very accepting, like they've gone through their life dealing with this. They know how to do it. Sometimes you'll get people who, they're getting along fine. They might use an assistive device, maybe not. And then something happens that makes it more difficult for them to deal with it, and they end up coming into PT. So I had one person who had post-polio, and I don't remember which side was the more affected side. Usually they have a more affected and less affected side. Let's just say the right leg was weak and the left leg was the strong leg. Well, they ended up having a problem with the hip on the strong side, and they had a hip replacement on the strong side, and so now their weak side they had to depend on their weak side, and they came into PT to help deal with that. You know, lots of different things that you'll see with post-polio. Most of the people I've met with post-polio, they are well aware of what they need to do to deal with their symptoms. They do fatigue more easily than people without post-polio, and you just have to moderate their activities. And most of them really know how to do it well themselves.